Welcome to Skyscape's free webinar series. I am Kristen Snowden-Smith from Skyscape, and I will be the moderator for the webinar. Today's webinar, we will be looking at integrating active learning in the curriculum, an unfolding case study. Our speakers today are Dr. Tim Bristol and Karen Sherrill. Tim is a faculty and student success specialist. He works with a number of colleges and universities and resides in Minneapolis, Minnesota. Tim has been utilizing technology in the classroom, clinical, and lab settings for over 20 years. His motto is, "Today we will learn how to learn." Karen Sherrill is a faculty in Phoenix, Arizona. She teaches in pre-licensure programs focusing on active learning with the use of technology and student success. Her motto is, "If we finish class and your brain doesn't hurt, I haven't done my job." I will now hand the floor over to Dr. Tim Bristol.
Thank you, Kristen, and thank you everyone for joining us today. I just really appreciate you taking time out to consider active learning and consider what it might look like in your environment. The slide that you were looking at, the image that you were looking at on the title of this presentation actually was what we call a decentralized classroom. And the whole point in a decentralized classroom is that there is no front of the classroom, but it is more concentrated on students working together to meet their learning objectives. They're taking control of the learning environment. When I think of active learning and when I think of health occupations education, nursing education, I'm really thinking about how do I get the student into a clinical mindset so that they can see, so that they can appreciate, so that they can buy into the learning experience that's happening. I know many times I'm worried or concerned that if I don't communicate something overtly and directly to the students, they'll miss it. And that's actually a little bit of a fallacy, if you will, in the sense that just because I communicated it to them doesn't mean that they learned it. Case in point, in one particular school, I was teaching fundamentals, farm, skills, and clinical. And so fundamentals and skills came in the first 8-week block. And I had students do great in skills, and they tested out, they got good grades, they got high scores. And then I had some of those students the next 8 weeks in lab. And some of the students that did the best in skills in the lab environment totally missed it, right? So just because I said something in lab, just because I lectured on something in fundamentals didn't mean necessarily that they learned it. And so what I'm trying to do in the classroom, in the lecture environment especially, is make it look as realistic as possible so that the uptake is as permanent and or enduring as possible for my students. I want to introduce you to a nurse educator named Lee. And Lee here has been teaching for around 2 years now. And she just went to a conference. And we've all done this. And I just did it this past week. And we come back from this conference, we're excited. There's so many new things that we've learned. And Lee here wants to make her classroom active, wants to make it engaging. Who doesn't want to do that? Who doesn't want to have the students lead? I love Karen's motto, and you're going to hear from her in just a few minutes. I love her motto. If your brain doesn't hurt, I haven't done my job. I tell my faculty that all the time. If students leave your class and they're not tired, their feet don't hurt, right? Then you haven't done your job. You need to make the classroom engaging. Make it look like a clinical environment. And I'm not talking about putting head walls and suction and putting that up all over the lecture hall. I'm talking about how do we get the students to actually start thinking as if they were in that clinical environment. There's a phrase I want to encourage you to write down, okay? Write this down. If you're watching me via recording, you're lucky. My wife always says she wishes she had a pause button for Tim. If you're watching via recording, you've got a pause button. Pause Tim. If you're watching live, I'm sorry, you can't pause me. Write this word down. Clinical imagination. Clinical imagination. This phrase showed up in 2010 in Patricia Benner's book, on educating nurses, talking about how do we transform nursing education. And she says that clinical imagination is the link between critical thinking and clinical reasoning. And this phrase, this word, this term, clinical imagination, is now showing up in the evidence base. It's now showing up in the research, in the literature. When you go to CINAHL, you can now search for clinical imagination. One of our jobs, and why we pursue active learning, why we pursue, like Lee here, an active and engaging classroom, one of our jobs is to develop the students' clinical imagination. Now, also, although she loves this idea, okay, now Lee has a few things going on. Now, first of all, Lee, like you and I, most likely did not have an undergraduate nursing experience that was active learning. Okay, some of us did, but most of us did not. Most of us had more of the traditional model of a broadcast lecture, sitting in a lecture hall, and hey, we're good nurses, right? We're good nurses. We passed the NCLEX, otherwise we wouldn't be sitting here, right? But we did not grow up in an environment where there's active learning, okay? And when Karen introduces you to the student, you're going to learn a little bit about today's student that necessitates this active learning. But when we're trying as educators to engage students, there's some things that come up. You know, first of all, many of us have assignments that we're not necessarily comfortable with. Raise your hands right now if you've ever had to teach a class that you weren't comfortable with. Very good. Hands going up all over the nation, even though I can't see you. I know that that's a part of our reality. She's not confident in her material as she'd like to be, okay? So what do we do when we're not confident? We create everything that we need to say to the student. Everything that we need the student to learn gets typed into a PowerPoint presentation. You're looking at it right here, right? Now, let me ask you a trick question. Okay, so we want our students to be masters of prioritization. Okay, I want to teach my students prioritization. I want my students to be good at critical thinking. How do I teach my students to prioritize? Well, I put up a PowerPoint slide that has a list of the priorities of care for a patient with COPD. You know what you've just done? You've taken an application and analysis or higher learning activity, okay, prioritization, and you've turned it into remembering and understand, which is very low on Bloom's taxonomy, okay? I almost said Maslow. How's that? I'm getting my pyramids confused. On Bloom's taxonomy, it's very low. So what we have to do when we move into the active learning world, we've got to figure out, how do I give the students the opportunity to create? All right, you've already written down one word. You've written down clinical imagination. Now please write down another word, the word create. You've given your students the opportunity to create a set of priorities for a patient. Now, she's nervous about this because if I turn away from my PowerPoint slides, you know what might happen? I might not cover everything enough. It might not be covered. So, you know, when I think about this, there's different ways to manage it. And many of us have our own ways of trying to engage the students more, get more active learning in the mix. I'd like to hear from you here for just a moment. What do you or would you use for active learning in your classroom? Okay, there's many different ways to do this, okay? Many different ways to do this. And there's a poll open right now, so if you would go ahead and click in the poll there. Can I define active learning while we're voting for just a moment? Active learning is about the learner doing something with whatever it is that they're supposed to learn, or they're doing something in the process of learning. Passive learning is the learner is doing nothing. The learner is simply a recipient of information, okay? It's important for us to understand the difference between active learning and passive learning. Okay, I had one faculty member tell me, and this faculty member easily had been in academia for 30 years. And I said, yeah, tell me about active learning. What kind of ideas do you have? And he said, yes, if the students start to look tired or bored, I talk faster. And I'm like, wow, we have a real difference in opinion or idea of or understanding of this idea of active learning. So when I say active learning, what I'm actually referring to is the students are busy. We want them to be tired, as Professor Karen Sherrill says. All right, how are we doing on the poll there, Kristen?
We're doing good. We have about 66% of the people have voted. And
get out the vote, folks. We need your vote.
And let's see, I'm going to close the poll.
All right.
Do you see? Let me share. There you go.
Thank you. All right. Does everybody see the polling? There we go. And it looks like many of us are using some type of mobile learning. We have a lot of gamification going on, a lot of use of clickers. Okay, wonderful. All right, well, thank you. Well, let's go ahead and continue our journey here as we look at active learning. Now, the first thing that I want to say to you is, you know, students are going to come to you and they're going to say, we need the PowerPoints. Okay. That's okay. I'm not saying get rid of the PowerPoints. What I am saying is help the students find ways to manage low-level learning, knowledge and comprehension, remembering and understanding. Help them engage some of that early on, okay, sooner rather than later, as opposed to they have to come to class completely blank slate and they dive in and by you giving them knowledge and comprehension. Because it's really hard. It's really hard for a learner to sit by themselves or to be separated from the group and really go to a higher level of learning, okay, a higher level of learning. When you study theory related to critical thinking, clinical reasoning, when you study how people do that, you'll learn that very rarely will a theorist, will an expert in critical thinking say, students, you can become a good critical thinker by sitting by yourself in a corner with a book. Most of the time, it's students engaging each other, okay? And students working together. So all this to say, as we're preparing for active learning, sure, give them the PowerPoint. Give them the recordings of certain parts of the lecture. Let the PowerPoint be a guide for the active learning. Let's talk through a few examples here. So for instance, recording lectures. When I think about recording lectures, what I see is little snippets, mini lectures. Okay, I was with 250 faculty in Wisconsin about 2 weeks ago, and we got the opportunity to talk about how to create a quick video that can really benefit your students. So let's take acid base, for instance. There are 4 components of acid base. What are they? Good job. Metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. So if that's part of what we're supposed to learn today, what I'm going to do is create 4 10-minute videos. Now, why am I creating 4 10-minute videos? First of all, number one, the attention span of most of my students is not going to be much longer than 10 minutes. And there's some researchers that argue that it's less than that. Okay, or if you think of our students' busy lifestyle, all right, I had one student with 4 kids, all of them were in sports, and her husband drove truck and was out of town. She had to not only go full-time to nursing school, but run these kids all over the place. So she gets to from point A to point B, she's got 10 minutes to listen to one of my 4 10-minute videos. And guess what? Because it's so important, she can listen to it multiple times, like before lecture, before the exam, before simulation, before clinical. She can keep going back and listening to those snippets. The other reason I want to make short video clips, 10 minutes, is because if I make a mistake on a 60-minute video, right? Think about it. I made a 60-minute video and I make a mistake on minute 32, okay? Unless there's a teenager around, I'm not going to be able to fix it, and I'm going to be in trouble, okay? Now, fortunately, I still have a few teenagers floating around, but they're not going to be here forever. So that's why I like creating small, quick clips. The other thing that I want you to do is write down the word Hollywood. Write down the word Hollywood. So now you've written down 3 words. You've written down clinical imagination. You've written down the word create. We want them to create a priority list. Now write down the word Hollywood. Go ahead and put a big X over the word Hollywood. Your videos do not have to be Hollywood. If you want proof, go to YouTube and look at what videos have gotten 3 million hits. It's a baby laughing at a little duck and falling over. Okay? No Hollywood involved. Now, use the PowerPoint to guide your learning activities. Let me give you a perfect example here. Teaching fundamentals. And by the way, if you're a fundamentals instructor, I'm giving you a high five right now. You have the most important class in the curriculum. High five. There we go. Fundamentals. In fundamentals, we were teaching Maslow's hierarchy of needs. All right. And I'm sitting there looking at this. I've got like 10, maybe 15 PowerPoint slides on Maslow's hierarchy of needs. And I'm going, there's got to be a better way to do this. So what we did is we still had the 15 slides on Maslow's hierarchy of needs. Okay. We got a case study. Here's a key. Okay. We got a case study out of their maternal child text, or maybe out of their med-surg text. We got a case study. And we said, okay, even though you've been in nursing school for 2 or 3 weeks and you know really nothing about nursing yet, I want you to apply Maslow's hierarchy of needs. Use these 15 slides before I even talk through them. Use these 15 slides, and I want you to start to find in this case study, where are the most important needs? Where are the secondary needs, the tertiary needs? Where is self-actualization? Okay. Have them, even at the earliest stages of the nursing curriculum, instead of you telling them what the information is, have them go into the apply mindset. All right. Now, when you're lecturing to students, it's like I said, whether it's video or not, you got about 10 minutes, and they have to do something with the information. Okay, they have to do something with the information, and the best way for you to do this. The best way for you to do this is set a timer. If you don't have a timer, you know what you're going to do? You're going to look at the next 30 slides and you're going to go, oh, we're almost done, or oh, this is so important that I need to talk about it. That's how important it is. I need to talk about it. The problem is the students aren't learning. They aren't applying. They're just listening. And before you know it, the entire lecture time is gone and the bell rings and the students are out the door. Set a timer for yourself. No matter where you are at 10 minutes, put your students into the apply mindset. Okay, so teaching pharmacology. I'm teaching pharmacology, and let's say that we're talking about loop diuretics furosemide, okay? And I'm watching the clock. I'm doing like that bald guy from Minneapolis said. He said, set a timer. So I set a timer. 10 minutes has gone by. I've been talking about loop diuretics, bumetanide, furosemide, etc. I stop and I go, okay, students, I want you to write down 3 assessment findings. 3 assessment findings for a patient that would be an indication that they would need Lasix. Go right ahead, write down 3 findings, 3 assessment findings that would say this patient may need Lasix, okay? And so I'll give them 2 or 3 minutes, and I'll put them in groups of 2 to 3. I don't like them doing a lot of individual things in class. When we're together, I like to be together. I'm a together kind of person, okay? I don't have it together, but I'm a together kind of person. So I have them write down 2 to 3 things, and then I say, okay, now you've just given 20 milligrams of IV Lasix. It's an hour later. I want you to change those 3 assessment findings in some way, shape, or form based on the fact that an hour ago they had 20 milligrams of IV Lasix. Go ahead and write that down. Now, I want you to share what you wrote down with a group nearby. You see what I'm doing? It's not about Tim at the front of the class continuing to talk more, continuing to lecture more. It's making them apply. Now, Tim, what if they didn't learn enough about Lasix to do that? This is where evidence-based practice on the fly becomes the centerpiece for their learning. There's another phrase for you to write down. Evidence-based practice on the fly. EBP on the fly. If a nurse engages a problem that he or she doesn't remember or understand, they need to go to the evidence base. Okay? Same with your students. Don't enable your students. Don't enable your students, okay? When I'm walking around the room, they're doing their little exercise. I say, write down the 3 findings that indicates a need for furosemide. Now write down the response to giving furosemide. Now compare with another group. So what I'm doing in these little groups, in these little microcosms of a group, if you will, I'm having them compare and contrast with each other and argue with each other and learn with each other. And then I'm asking questions. I'm walking around the room and I'll ask them a question. They ask me a question, I ask them a question back. I don't become the resource, I become the facilitator. I point them towards their resources. Get your phones out, open up your evidence base, answer the question that you just asked me. It's that right there that's going to help them be successful. So Lee's school uses apps and online tools, and she wants to bring these into class. So many times we say, okay, buy your drug guide, buy your lab and diagnostic book, you know, and have those ready to take to clinical, all right? Now, because they're on the phone, because they're on their handheld, because they're on their tablet, these can come to class. Now let's talk about bringing clinical to class. One of the biggest benefits of bringing clinical to class or bringing these clinical tools to class is that when they're in clinical, they're more likely to remember what happened in class. It makes sense, doesn't it? We want to do this bridging, and we want to have as many clinical tools in class as possible so that when Lee is teaching, she is able to help them make that connection. She encourages students, bring your phones to class. Put them on silent, right? But Tim, my students are just going to Facebook. My question to you is, why do they have enough time to Facebook? But Tim, my students are going to send text messages and they're going to do ChapSnap. Yes, it's called ChapSnap. I changed the name. They're going to do all these things during class and not pay attention. Why do they have enough time? Right? So we need to keep them so busy that they're only able to use their phones for clinical reasons. She provides them with a chart. Isn't this beautiful? All Lee didn't create all this. Lee did not create all this, okay? I need you to do something with me real quick. Raise your right hand and repeat after me. Everybody got your right hand up? I know some of you don't, but that's okay. Raise your right hand and repeat after me. I will not create a case study. Go right ahead. I will not create a case study. Very good. Go to the sim lab. Take a look at the simulations that they're using, and more importantly, take a look at all the simulations that they're not using, that are there. Bring those patients to class. You've got MARs, you've got full patient records, you've got lab reports. She brings the students these documents, and she stands at the front of class. She gives them report on this case study. In this particular case, she's using Mr. Jacobs. He's a patient who was admitted with COPD. And now what she does is she asks the students, can you summarize the pathology related to this diagnosis, Mr. Jacobs' diagnosis? And here's something really important about active learning. If you have one student stand up and say it to the entire class, that one student is engaging in active learning while the rest of the class is engaging in passive learning. Have the students talk to each other. But Tim, what if one student says something wrong to another student? Guess what? That's why every day of class, I tell the students, you must partner with someone new. Have them create a concept map about Mr. Jacobs' care priorities, all right? Create a concept map, and I like the 1 minute map, the 1 minute, we call it micro mapping. This is a tool that Karen and I have created to help students quickly concept map based on prioritization. Do it quickly, and it's more clinically related when we do it quickly. Justify the medication or connect the medication to a lab, to an assessment, to a history. You see, I could be lecturing on all of this Each one of these bullets could be 4 or 5 PowerPoint slides where I'm saying it to the students. Okay, if anything, what I need to do is I need to go into my PowerPoint slide and have the title pathophys, but there's nothing written on the slide. There's no words on the slide. They have to add the words. They have to create, justify, and then I have them look up the medications in preparation for giving these medications. Now, here's the trick. When you open up your drug guide on your phone, okay, here's the trick. You've got to quickly do it and quickly find priority information. You can't sit there for 30 minutes with one medication. This is a habit. This is a habit. And they need to be able to do it quickly, okay? And as we think about that priority, what are some of the teaching priorities? All right, and let's move quickly again, because clinical, we do not have unlimited amount of time. And as we're taking a look at the order sheet, which one are you going to implement first, students? Okay, which one are you going to implement first? Students make the mistake sometime of thinking the top of the order sheet is the priority. And that usually, you know, says something like up ad lib, right? That's not the priority in this situation. It's the 20 milligrams of IV Lasix. That's the priority. It's oxygen, 2 liters nasal cannula. That's a priority. Help your students start to navigate this with you being there with them. Then have them create an SBAR. And I have seen so many creative uses of SBAR. Have the students create an SBAR. Have them put the SBAR in their phone, tap it into their phone, okay? They give report to someone else, again, a new friend in the room, and they give feedback on each report. Students complain about that test question. They complain about that problem on NCLEX all the time. They were given report. They must respond to the report. Let them do that within the context of what you're teaching. And then take a look at a current study, a recent review, okay? Again, show the students what evidence-based practice on the fly looks like. It's very important. We have another polling question here for you. What resources should students use during these classroom activities? What do you think? I've kind of thrown out a few here. This is a select all that apply, by the way, so go ahead and click in. We're talking about classroom time. We're talking about classroom time.
We have about 62% voted, Tim. We'll hold the poll open for another 20 seconds.
All right. Go ahead and click in. There you go. You know, when we think about resources in the classroom, I think all of these need to somehow, in some way, shape, or form, be a part of it. And here's why. Class time needs to be higher order thinking. And when they're in class, they're teaching, that they're learning a lot of these principles that are higher order, higher level. They're managing content at a higher level, so they need to learn to use their drug guide. They need to learn, how do I open up the diagnosis handbook and quickly get to a nursing diagnosis, a medical whatever that's going to help me out. The lab manual, how do I use the lab manual for critical thinking, for prioritization? Our textbooks, our students need to open their textbook. And guess what? If you don't teach the students how to use Google, they're going to use it anyways. So these are lots of opportunities here. Now, as she's trying to work through this, and she does a muddiest point, she does a start, stop, continue type activity. She starts to talk to the students, you know, and get information back from the students here. And it looks like most of you are using the drug guides and the textbooks in class. Very good, awesome. She does get some positive feedback in that the students start to feel more like real nurses. Okay, they start to feel more like real nurses as they explore the chart, as they use their clinical reasoning skills. Again, fundamentals instructors. Remember, if you start the students off early in your program with this kind of mentality, this kind of philosophy, they're going to learn to expect it, and they're going to learn how to learn in that way, as opposed to the option, which is going home and memorizing all the words and definitions on the PowerPoint slide. They're going to learn how to learn right out of the gate. So going back to my example, using Maslow's hierarchy of needs and giving the students the opportunity to take care of a patient even early on, they love it. All right, so week 2 in Lee's classroom, she plans her approach with cardiac content by using role play, okay? She brought some basic assessment tools to the classroom, hospital gown, you know, there's always a stack of them in the lab, just grab them when, you know, you can ask for permission or forgiveness, whatever you want to do there, you know what I'm talking about, you know who you are. Anyways, Lee becomes the patient with chest pain, and she's moaning, okay? Now, the students have to come up to the front of the class. They have to get up out of their seat. Now, I realize that some of you have unideal classrooms, okay? The classroom environment isn't the best for some of this. Get them out of their seats, have them stand in the aisle, have them stand in the front or the back. Getting them out of their seat raises their level of awareness, all right? Students come out of their seats, they come to the front of the class, they ask questions, they do the PQRST on her pain. After the assessment, there's feedback given, okay? And then she goes back to the class, she goes, okay, now what kind of interventions are you going to offer me in this situation as your pain? Now, medication-wise, we pull out an MAR. And again, having this clinical tool, and if you, again, talk to the people in the lab, they have so many samples, and they can quickly find them because they're categorized by whatever it is you're teaching in class. So for each medication, you know, we're talking cardiac, find the cardiac medications there. What's, you know, how does it work? Why does it work? When should the medication be given? Okay, when should we give each medication? Have them have some real serious clinical discussions, all right? So this is kind of just some examples from Lee's classroom. Now let's hear from one of Lee's students. Go right ahead, Karen.
Thanks, Tim, for that great segue. I love your enthusiasm and your great ideas for the active learning in the classroom. We're going to transition just a little bit, and now we're going to talk about one of Lee's students named Lindsay. Lindsay's a second semester student, and she's concerned because she's taken her first exam in Lee's class, and she was not successful. The challenge that Lindsay has is that schools always come very easily to her, and she recognizes that she's never had to study. So she doesn't know quite how to focus her study, and she's coming to Lee out of concern for her grade and out of concern in how to be successful. Well, Lindsay is not like, or I should say she's very much like the greater majority of the students in my classroom. And whether our students are English language learners, whether our students come out of maybe a substandard K-12 system, maybe they have skated through their school education, or maybe they struggled through and were able to be successful in completing it, but they never were able to give them the guidance and the direction they needed in order to study. And now they're suddenly in the nursing program, and we're clearly recognizing that this student needs a lot of direction and needs a lot of guidance. Oftentimes, it feels almost like a stampede as they're coming to your office. Excuse me, as you're recognizing, I'm not going to have the time to meet individually and to meet all these students' needs. But the significance is I want to early identify who my challenging students are. This case with Lindsay is great because Lindsay had the guts to come to Lee. But the challenge is the fact that so many of our students don't have that assertiveness, don't recognize they have personal challenges, or they are simply just hesitant to come. They feel like they're going to be a failure. They feel like they're going to be pointed out as being different, and they don't necessarily come to our classroom. So I think it's very important as educators that we're early identifying these students that are at risk. If we can even capture them before their first exam, it's so important. I like to go into the cohort of students coming forward to me and look at their exit performance and their final grades in the previous class. not for a means by which to target students or to identify who my quote-unquote difficult students are going to be, but to recognize that it's a student that's coming in with some potential weaknesses and do some early identification. I typically reach out to these students within the first week of class by sending an email or touching base with them in class and say, I can really see that last semester was a challenge for you, or I can see that you had some difficulty on the end of semester exit test. And I find that concerning, and I want to make sure that you have all the tools you need to be successful this semester. So why don't you come to my office, let's sit down, let's look at some of your study strategies. What are things that you're using that are working, and what are some things you're using that are not working? And many times having this personal touch is so important during those first few weeks, because that student is not yet freaking out because they failed your first test. When they come to you after failing the first test, the anxiety level is so high, and many times they're in panic mode. And the fact that they only have 10% of their course grade behind them, that doesn't set their mind at ease. They're convinced that if they fail your first test, that they're going to fail the entire course. So rather than having that student be in panic mode, it's really important, I think, to make that communication, caring response prior to your first exam. Oftentimes, my calendar is a little bit more open during that time too. At the first couple of weeks of the semester, I'm not quite as bogged down with many things. It's new, fresh. I've got, a good fresh start to the semester, and it's a time I really like to individualize the care that I give to students. One of the things that I saw just the other day, I actually saw this, I've got two kids that are in college, and my younger son received an email. He forwarded it to me. It was from one of his college professors. And the college professor had reached out to my son on an individual basis and simply said, I really appreciated the comment you made in class yesterday about this particular topic. I recognize that you had some really great deep thinking going on, and you were looking at that from a wonderful articulate view. I like the way you orchestrated your comments in the class. Thank you for contributing. And that was it. That was a single email sent personally to my son from his college professor. And I walked away from that going, you know what? That's what I need to be doing. I need to be looking at these students in my classroom that are really struggling, that are challenged, that are introverted, that are not coming to me, that have zero self-confidence, and send a personal email recognizing the contributions they're making in class. And I thought, what a positive direction that could really guide and direct the students, giving them the confidence they need in order to be successful. So Tim, if you can advance that slide. So what are we going to encourage for Lindsay? Well, one of the important things we need to do is Lindsay needs to form some habits of study. Her study skills have not been sufficient in the past, and she needs to try to create those habits. An important piece of creating a habit is making sure that you're identifying something you're doing every single day. So chunking the material, making sure that Lindsay is not cramming before the test, that she's not sitting down in a single day on a Saturday and reading an entire chapter of material, making sure that she's creating that habit by going back and revisiting her material on a daily basis in smaller amounts of time would really encourage her to be more successful. She wants to focus on the top 3 priorities of care. Recognizing, and this is what I love to tell my students, is chances are I will not have a test question on priorities number 5, 6, and 7. Chances are I will have test questions on priorities 1, 2, and 3. So that then forces students, every time they're looking at the material, thinking to themselves, what would I assess first? What would I assess second? What would I assess third? What is most important in the care of this patient? What will I intervene first, second, and third? If this potential complication arises, what am I going to do first, second, and third? How do I recognize this potential complication is occurring? And make sure they're continually prioritizing their care. There's a number of ways you can encourage students to do this. I love the use of color, whether it be colored sticky notes, whether it be color highlighters, encouraging students to determine their priorities. And that I love the appearance of the red, yellow, green, like a stoplight. That's a concept that students easily can recognize, knowing that red is urgent, it's concerning, whereas green is not as important. So I encourage them using red, yellow, and green consistently in identifying red as their highest priority. That's the one that's most urgent that I need to take care of first. Next bullet there, Tim. So what else do we want to do? We want to make sure our students are taking test items. And they need to consistently be taking lots and lots of test items. The 50 to 75 questions a week, although it is a lot and it's a lot of time, if you have lower performing students or English language learners, I encourage them to take sometimes twice that many questions. And let me tell you the reason why. I had an experience one time. I was going to do an NCLEX review course in a school, and I oftentimes will get their exit results prior to doing those consultations. So I obtained the exit results from this group of students, and I saw they had the highest scores I'd ever seen in a group of students. I was excited. I was so thrilled. I couldn't wait to go to the School of Nursing because I wanted to determine what it is they're doing to prepare their students to take these exit tests and to score so highly. And I wanted to bring that back to my own students at my own school. When I got to the classroom that morning and I was setting up, I recognized that there was not a single student in the class that was speaking English. Every student was English as a second language, which confused me even more because when you look at the literature, it's very evident that students that are learning English struggle more, especially with written exams. So I was very perplexed as to how these students performed so well on this exit test, reading an English exam, and of course translating to their foreign language in order to answer these questions. So I asked the students, I said, you know, hands down, you guys had the best scores I've seen in all the years I've been doing this. Please enlighten me as to what you think your school did in order to prepare you for this. Student in the front row, quiet little passive student, raised her hand and she said, you know, Mrs. Cheryl, I think the reason why we were so prepared is because since the very first week of class, we have been required to take 200 questions a week. 200 questions a week, NCLEX style questions on a computerized test bank had actually turned this group of students into expert test takers. Now let's face it, just being a good test taker does not make a great nurse. I see a great nurse as being a three-legged stool. You have to have a student that knows and understands the content. You have to have a student that's clinically competent and safe for practice, but you also have to have a student that can take test items. Because if a student cannot take test items, they cannot pass the licensure exam and they cannot become a nurse. So encourage your students to take 50 to 75 questions each week. A great repository that's available to them, one of many that are out there, but of course Skyscape offers an NCLEX question of the week. They also have some question banks that are available in some of their downloadable products, many of which offer some free questions for your students. So I encourage you to tap into those resources as one of the many repositories that students can be using to access 50 to 75 questions a week. Next bullet, Tim. Prepare before class. You know, we want students to be prepared coming in the door. If they come in with that base knowledge, you can escalate that class to a much higher level. Lindsay needs to be prepared before she comes to class. She needs to review the material. She needs to listen to voiceover PowerPoints. She needs to be reviewing and skimming the chapters, if not able to read them. She needs to be taking notes from those chapters. If she is writing as a preferred learning method, she needs to be taking notes and summarize each section of the material. Next bullet, Tim. Summarizing, in fact, I just said this. Summarizing each section is really important. Students can read chapter upon chapter. They can highlight upon highlight. They have a very colorful book covered with highlighting, but they haven't absorbed anything. It's hard for students to determine exactly what's most important. So I would encourage Lindsay to read a section, skim it first, read the section, and then in her own words, somewhere else, if she's a writer person, have her summarize it by writing it out. If she's a verbal person, have her speak it into a tape recorder. Her summary of her chapter section, she can type into it, she can read into her phone recording device, listen to that back later. If she's auditory, she'll have a lot of value in that. So thinking of ways to modify learning for Lindsay so she optimizes her study time would really be beneficial. Encourage Lindsay and all your students review their notes within 24 hours. In doing this, we're capturing the short-term memory. When a student prolongs a review of their notes after 24 hours, their retention level drops significantly. They can't remember the details of the discussions on the classroom, and it really is a disservice. So making sure that all your students are reviewing their notes within 24 hours, highlighting and prioritizing pieces of material that were most significant in the class that they just attended. Study groups, making sure that Lindsay's in an effective study group. And we know that study groups can be effective and they can be ineffective. I encourage study groups of different learning styles. I encourage study groups that are not friends. Oftentimes, when students get together with their friends, it turns into a social event and not necessarily a learning opportunity. I also encourage students, and I would encourage Lindsay to create a study group with a plan and with an assignment. So students don't just come and say, okay, what should we review today? But they have a preset assignment for that study group. So one of my assignments would be, okay, guys, we're going to meet on Friday at 7 o'clock at Starbucks. Everybody review the case study at the end of the chapter, because we're going to discuss that in our study group. Students are then going to be applying that knowledge rather than simply reading through their class notes and clarifying conversations that took place in class. Have study groups going to a higher active application level is really going to benefit students, especially students like Lindsay. Of course, we're going to refer our students to any kind of tutoring services, making sure they're getting that solid study skill development. We cannot possibly touch every student in our class. Smaller class sizes possibly, but if you're looking at 40 plus students, it's really difficult to work individually with these students with the significant amount of time and effort that takes. Have them also accessing outside campus tutoring services and building that study skill repository that they're going to need to be successful. Next slide. So here's polling question number 3. And looking at study resources, what do you think Lee should recommend for Lindsay? And this again is a select all that apply. What would be beneficial for Lindsay? As you're completing that, let me talk a minute. A note-taking system would be a process by which the student has a regular systematic way of creating notes, taking notes, so that it's developing those habits of study that we talked about. Looking at those clinical skill tools, whether that be something electronic or something that's a paper copy. Do they have the ability to apply those study resources? Q&A, of course, whether that's a book or an app, and the study group. So I'll give you about 10 more seconds to finish making your selection here. And Kristen, are you able to show us the results? So looking at like the majority of the people see that Lee should be recommending to Lindsay all of these things. And I see the one that was not selected quite as commonly are the clinical skills tools. And granted, we're thinking, okay, classroom, clinical skills tools, probably kind of a disconnect there. But the reality is that if we're bringing those lab clinical simulation into our classroom, those clinical skills tools could also be very, very beneficial for Lindsay. Could we be applying those critical thinking concepts after a student is observing a skill performance? Could they be recognizing ways in which that performance could be made better? Ways in which maybe infection control was breached? Could they be looking at some of those skills tools and developing those thinking skills, which is exactly what Lindsay's going to need in order to be a stronger nurse? So thank you for the poll. We can pull that down. So let's migrate now. Lee's now taking her students into the skills lab, and she likes the process of using a ticket in the door pre-assignment. I'm a big advocate for this as well, because traditionally how skills labs go is that students come in unprepared. All they know is that their agenda says they're doing NG insertions in the skills lab today. So they walk in the door, and sometimes they have their uniforms on, and sometimes they have a part of their uniform on, and their hair is maybe not pulled back, and they've got dangling earrings. I'm an advocate that the lab is a clinical setting and that students need to be dressed for success. It's a professional environment, and they need to be presenting that the minute they walk in the door. We need to hold them accountable for being prepared for lab, not just simply show up, but they need to be prepared by having watched a video before coming to the skills lab. Oftentimes, traditionally what happens is they gather around a bed and an instructor, the wise instructor, is going to demonstrate the skill for the students. The challenge that I have with this is that it's great for your visual people. It does not work effectively for your kinesthetic learners because watching is not allowing them to do it. And the reality is putting an NG tube down, I don't care how many times you watch it, you got to be able to do it. And if you can't do it, you're not going to be a safe practitioner. They can watch a demonstration on a video before they come to the lab. So when my students come into the lab, they have already prepared, they've watched a video, they've reviewed their checklist. If they're a reading student, a read-write student, they need to be looking at each step of the checklist. I point them to the mannequins, to the NG tube, to the supplies, and say, start, go. And they have to be able to safely practice that skill. They do not get a demo before they come into the classroom because I have expected they've already prepared. Now, there are going to be some students that are struggling through the steps, but what I encourage them to do is pull out their skills list because I feel that this mimics the policy and procedure of an institution. If I have to perform a skill in an agency and I've not done that skill in the last 5 years, for whatever reason, it's expected I'm going to pull the policy and procedure and I'm going to perform the skill according to the policy of the agency. It's a recipe card. So I have students follow recipe cards in the skills lab. I feel that's more realistic than having them watch me perform it and then me tell them the steps as they walk through it. Most of the time when they're doing these skills in clinical practice, they're not going to have someone to be there at their side telling them what steps and what to do next. The goal of this is to allow the student that hands-on kinesthetic learning. This is the only time that they're going to be getting this in most cases. They've got to get their hands on those skills for every minute of time that they're in that lab, not watching it done, but actually doing it. Next slide. So when we look at the learning skills, another poll here, which methods are best for your visual learners? Select the ones that you use. And this is your own personal choice. You can select all that apply. So do you read about the skill and steps, watch a video, answer NCLEX type questions, record a video, perform in simulation lab or clinic? Which of these methods are you using? And for the sake of time, let's go ahead and close out that poll and see where we're at. Okay, so watching video is pretty popular. Excellent, I love that. There's some really great evidence-based videos out there. And I, of course, know that some of the Skyscape products, the Skills Hub also offers the video component. So that's a great opportunity to have some wonderful videos for students to view first. Excellent. If we can pull that down, great. Thank you. So what else do I want students to do in the lab? I want them to get as much hands-on time as possible. But one of the things that Lee is recognizing here is that what we teach in skills, when we're putting an NG in a plastic mannequin or we're putting a Foley cap in a plastic mannequin, it's really not reality. And Lee's thinking back of the time when she had to put a Foley catheter in a 350-pound woman who had a fractured hip. And what went through her mind was, wow, they didn't teach me this in nursing school. And that is so much of the case. We teach students in the lab perfect setting. This is ideal. But the reality is 90% of the time that we have to perform skills in a clinical setting, it is anything but ideal. So I like to throw students what I call my curveballs, and it's just simply to stimulate their critical thinking. So let's go to the next slide, and here's some examples of curveballs. I will have students that will be performing an NG insertion, and I can walk over and hand them a card, and I'll say, as you're placing the NG tube, client begins to cough harshly. What are you going to do? And I'll have a pair or a trio of students there that are putting that NG tube down, and I'm going to have them talk between themselves, and they're going to determine, okay, what am I going to do in a situation like that? What if this happens with my patient? Another example is the next bullet. You need to change the client's IV, but their platelet count is 45,000. What are you going to do? Well, just putting an IV into a plastic mannequin is not creating thinking. My students are following a recipe card in order to make that skill happen, but what I want them to do is critically think and clinically reason through, what would I do if I had to start this IV and I've got a patient who has a potential for hemorrhage? What am I going to do differently with this particular skill? So another example, as you're turning your client, their abdominal surgical dressing becomes saturated with blood. What are you going to do? So rather than just teaching the changing of the abdominal surgical dressing, what am I going to do if this abnormal happens? And let's face it, we've had this happen before as practicing nurses. So stimulating that thinking in your students and making your lab more active learning is important. The next one, you're ordered to give Lasix. Your potassium level is low. What are you going to do? So I like to use this one during my IV push lab. I'm teaching the specifics of how do I deliver an IV push medication, but I also want students thinking through what if. What if this happens? What if this happens? What am I going to do differently with this procedure? How am I going to change my plan in the care of my patient? Next one. So clinical day, and I'll go through these fairly quickly. So Lee's going to the hospital for clinical. She sees that the unit census is very low. Who has that ever happened to before? I'm sure everybody is saying, yes, I've had that happen more times than I'd like to admit. So what are some things we can do with these students? How do we keep them engaged when we have 10 students, not enough patients, and it's a 12-hour shift? So let's look at some ideas of active learning, ways in which we can improve upon those clinical days when we don't have enough patients for our students. Go ahead and change the slide. So putting students in pairs is very beneficial. We want students to brainstorm off of each other. They are going to teach each other when they're working in pairs. Usually if you put them in 3s and 4s, sometimes it's too overwhelming for patients when this entire entourage comes walking in, but 2 is a pretty manageable amount. And I'm going to have students listen and auscultate heart and lung sounds on 5 different patients. I want them to compare and contrast the differences between those 5 patients. Another idea, I'm going to have them gather supplies for an urgent procedure. So I'm going to tell the students, okay, the doctor's just walked down the unit, wants to place a triple lumen central line. Go gather everything you would need for that. Go into the central supply area, pull all the things that you would need for that skill in order to assist with it, or a chest tube placement, or an NG insertion, and get students in the mode of what do I do if I have an urgency and I have to gather things quickly? What will I do? Another choice or another option, compare and contrast the fluid and electrolyte status of 5 patients. Have students do a chart review. Have them look for INOs, daily weights, medications that would impact fluid and electrolyte status. Have them compare and contrast. Why do these patients have fluid volume excess? This patient has fluid volume excess, but they're so different in the way in which they present. See if they can recognize those clinical differences. Practicing handoff report to each other. Evidence shows that a huge majority of medical errors occur during communication handoff report. Students have got to practice this constantly. So getting in the habit of doing that is so important. Formulating that SBAR to the healthcare provider, again, cannot do it enough. Communication is so critically important in the clinical areas and everywhere. Next slide. So Lindsay came back to Lee. She appreciates the changes. She's been making adjustments in the way in which she's studying, and she feels that things are really going better. She told Lee that she really appreciates the use of her unfolding case studies and using in the form of test items. And she thinks it really has allowed her to grasp the content perfectly and take her thinking of higher level items to a different direction. So let's go through a couple examples of these unfolding case questions that we can use with our students. We'll go to the next slide. So what do we want to do when we're working with unfolding case studies? You don't want to lay out everything for your students. You want them to be putting the pieces together as they progress through the case. So give them very basic admission information, but don't give them the answers. Have them come up with the answers. For example, the nurse is working as a charge nurse in the emergency department when a 60-year-old female arrives who's been vomiting and has had diarrhea for the last 2 days. Boom, end of case. Now I'm going to have students decide what's my highest priority, my greatest concern. I can also have this unfolding case turn into some prioritizing questions. So after my students have critically thought through what they're going to do with this 60-year-old who's probably very dehydrated, and I've prioritized my care accordingly, I'm now going to pose to them, the nurse places the client in a hospital gown and onto a stretcher. What should be the nurse's next priority action? Now this reads just like a test question. And I'm going to have my students come up with the answer choices, A, B, C, and D, working in small groups. They are then creating a test question with appropriate priorities. And you can use these questions. If you revise them, you can use them on your exam. I like to take these student-written questions, post them on a discussion post for my course, and students can use them to test each other on where they've come up with the correct answers. So this just basically gives the stem of the question while the student's creating the answers based upon this unfolding case of this 60-year-old patient. I think there may be one more bullet point here, Tim, that goes with this. So again, you can see from this slide, it's an unfolding case. I'm posing the questions, the students are determining the answers, and we can do it in an A, B, C, D format, turning it into a high-level test question. Next slide. So Leah's pleased, she's satisfied, she likes the changes she's made. It's going to be important for her to develop that repository. And one thing that's real important, that all these activities that she's implemented in the classroom, in the lab, in the clinical setting, they're constantly going to be changing and evolving. And there is rarely a time that I keep activities the same from one semester to the next. I think it's just human nature that we always want to improve upon them. And I encourage you to do the same thing. Keep your repository, share your ideas with each other, and it won't take long at all before you have a huge repository of active strategies you can be using in the classroom, really strengthening your student population, improving their ability to be successful. Next slide. So next I'm going to turn, and we've run a little bit over today, but I want to turn the presentation back to Kristen, and she's going to talk about some of the Skyscape tools that are available and talk about the evaluation for today's webinar.
Thank you, Karen. So Skyscape has some tools available to you for active learning, and I just wanted to tell you a little bit about them, and if you had questions about them, you can reach out to us. So we have a medical library, which allows you to build a comprehensive library of trusted medical and nursing resources from publishers and authors you already use. And this allows you to use them on the handheld devices, the smartphones, and the tablets. And certain resources are also available via web browser. We also have a clinical skills tool called Skills Hub. It brings your clinicals into the classroom. The Skills Hub platform includes a free app, and you can have your students download it today. Here they can read about the skill, they can watch a video about the skill, they can record themselves doing the skill in a HIPAA environment in SimLab, and there's also 5 NCLEX related questions with each skill, and this is a free app. In addition to this, we have a testing platform that allows students to prepare for NCLEX anytime, anywhere. It features an Ask the Expert service where nurse educators are on standby to provide clarification if a student needs help with the answer or the rationale. Next slide, Tim. I know we ran out of time today, but if you do have any questions, you can post them now in the chat and we will respond via email. Or you can email us at webinar@skyscape.com, and I will see that we answer those questions. I want to thank you for your time today. You can contact us more for any information on the Skyscape solutions for active learning at sales@skyscape.com. Visit our website, skyscape.com/education. This webinar will be available on demand later in the week with a recording and a copy of the presentation at skyscape.com/nursingwebinars2017. And again, email your questions to webinar@skyscape.com. Thank you and have a good evening.